Okay. So the salo all man who know say na short notice, but thank una for coming. That's all. I talk for pidgin because I think pidgin go be our preferred language so that all man go fit express himself. But person wey wan express himself na for country talk, may go ahead. That's all. I'll act as interpreter. Yes. So Dr. Sama be there here, but he don't just come out small, but he will come back. We'll also get Noella here, Noella B, and get Dr. Bernice Foryoung. When emergency room, person wey dey work now for emergency. Now, so now I go start for talk for we today. We did not say plenty time we dey hear about people the way they will get high blood pressure. The blood pressure can high so they get stroke or they get heart attack, or sometimes they no go even know say na stroke or heart attack the person get, and they'll just say the person be dey fine now, so he just come off for here, so he just fall for down, so bam, now all that. So now Dr. Foyong, he expertise that for act in an emergency like that. So he dey for here for advice we on how for act in different kinds of emergency. Say if now which kind of emergency, which kind first aid where you fit give am before that person go reach hospital, so that the person at least you go give the person a chance at life before he go reach hospital. Not be the one way person go just fall for down, they no nothing for do, only find you or move na phone for begin take video or take picture. The why you say one reach hospital, you don't die because say no man no be nothing for do. So people there instead stand only the funny or only take pictures, take videos for post and for social media way e not good. So Dr. Foyong dey here for give we small advice on how for act, which action dem for take, and you no need for be a doctor, nurse, or any health trained health professional for do that thing. The all man fit do am. So na thing that way e dey for here for advice we on. So Dr. Bernice Foryoung, the floor is yours, mama.
All right. Thank you now all so much. I be really, really happy for the year. Now my first time this, so I don't ever do the kind thing. And my name na Bernice Tango for Young. And I come out for my 12. My pa na pa Peter for Young. Ningu for Young. And my mommy na Veronica for Young. We come out for pa Peter Mukum he house. Uh want introduce myself because I like make people they know who they talk. And I know I like when people they know my background. For my training, I train like nurse. This my training start as nurse. And as I start with college nursing, I worked for like seven years as nurse, so emergency room. And then I continue for go school, go learn book for doctor level. So I get that nursing background, that person where they stand for you for corner bed when you don't go for doctor, where your head the hot. Doctor tell you all that in there, you know the air. Because you the fear or you the sick. And then when all things come out, so calm down. And then they start to talk about the treatment. I don't there for that position where I there for corner bed with you, the talk. Again, too, when I be know my pa and my mommy, they been a teacher then, so I get some small teaching where I learn am from them, from my background. So I like to teach my patient them. Nothing that I like to do. Because me, I believe say if person nothing for do, he go do one. But if you just throw away information, the likelihood, the possibilities they go do one will be very low. But anyways, the thing I want to talk about, I want to make I like to talk. The thing I want to make when I take them from this session where we get them now how to respond to emergencies. And we'll talk about different kind emergency situation then. We'll talk about when person wake up job collapse, just suddenly collapse, thing to do. When person get chest pain or back pain, thing to do. We'll talk about stroke, how to see stroke, recognizing that stroke this way person they get them, and things to do in that situation. We will talk about seizure, convulsions, epilepsy. We will talk about drowning. We'll talk about pregnancy emergency. Then, thing that way if it happen, that way man be pregnant. We will talk about breathing problems. Then we'll talk about some problems. Then we'll touch some problems. Then for picking them small, and then we'll also talk about mental health emergencies. So now they think that at the end of the day, when we finish a year, I want to say when they stop any man come up of that room, they say you yeah waiting. At least one of that thing them. I want to make each person take at least one of that thing them noting for do in that situation then. So I want to start with the big one because I want to make when I hear the big one then first. So we'll start with and I know it's people that face them. I like to see reaction. So first way get camera for
The
ground.
scene are silly.
If you fit turn make you see people that their face they're small, you go fine. I will still continue for talk though. So I want to talk about. We'll start with sudden collapse. You day for your work, you day for house, you day for marketplace. Some man drop fall. You know nothing way fall. You know nothing way happen. You just fall. Wait till you go do. Any man nothing way go do. If person fall, for corner if you front. If any man nothing to do, I beg. Come on.
Yes, that place where that if you leave am for that screen where they now so for.
Okay. All man no shake it, they no get idea. Okay.
Okay.
Okay, so man want talk.
Okay.
Okay, ma put camera there.
Okay. Hello,
Yeah.
Hi.
good afternoon.
Good
Good
I be
afternoon.
Madam,
afternoon.
I be Madam Sama Immaculate Azachi. When person just fall, like say he get anger or he dey cry, like how they go for cry die. When
Mm-hmm.
person just fall for down, we no need for crowd he, we no need for cover he, we need for give space. Then we will come his head up small, then
Mm-hmm.
we press it back and he chest. Then the fan ye. If it is suffocate for breath, would the fan in then the press his chest, press even his belly, so that me no choke me belly no stand with air. As with the press it back, would the fan ye, then would the breathe through, would the blow in nose, so that me take in air. The one way the give, and then me push that one way, don't block it, so that me be able for come back for that short comma way go. So now the little one that way I feel explain them and experience when me I don't do them when
Mm-hmm.
that kind of situation occur because some person it come inside cry that with serious pain. So when he
Mm-hmm.
want shout, it fall. So now wait that why they try for rescue some other people their lives them for occasion them. Thank you. Now.
Mommy, thank you so
Thank you.
much.
Thank you.
That thing where you talk so I sure say you don't use and really help people them. Because someone I go, you don't talk something the way you get for do, and I go add someone there on top. So when person fall, you talk some important point. Make we no crowd in. You see person fall, you know the crowd in. If you dare you one, you find make sure say the person there for safe place. You look and see whether the person they breathe. If he dey breathe, I will talk to him for do. You touch it, I don't know how whether people they know how for check pulse, but if you don't know, it be okay. You the touch in neck for see whether the heart the beat. Or sometimes if you know if you check out for neck, you the touch in hand for see if the heart the beat, if the movement there, you dey feel like it dey move. No stay for check 'em. If you check 'em, you know hear nothing. If now you one day, no stay you one. Run call help, then before you come attend for the person. If different person day for day, you call, you send the person, make it go call for more help. And the help where you dey call them, you want find person where you get motor. You want find strong people, the way they fit carry people if need be. And then you want find person too in a medical, if they get some medical professional for they, or if village get like emergency service where they rescue service, they fit call her, you call that kind of help, bring them. And then when you come back for the person now, you, if you know the breathe, you get for help you make it breathe. So thing where you do like mommy, you talk, say as you make sure say they for safe place, they lie down, you tilt the chin for up so, because as you put them for up so, neck the open as you see for here, you chill them for up, neck the open, and then you start the rescue breathing. You put your mop on top your mop, cover the, or you put your mop on top your nose, cover mop, and then you start to blow air inside the mop. If the person they breathe and if he get pause, nothing that you go do. If the person the breathe, no the breathe, if you no get pause, then at time that way you do that chest compression. Then maybe you talk say you depress belly so you put your hand, so your two hand and you put them for the middle part of the person in chest for here, and then you put all your weight on top you start the push down. You push the count. You push like 30 times, and then you go back for your mop, bring your head up again, blow air inside. Once help day, when I rush the person, go for emergency, go for hospital. That one makes sense. See what I talk so nothing way nothing say una fit do am.
Yeah, they say yes.
Yeah.
Okay.
All right. We will come back again. We'll ask question. If any man get question about them, I beg. Name man no hold them. May all man ask. The next thing we will talk now about uh stroke. How to recognize stroke and thing for do if person gets stroke. So any man know thing where stroke be?
I brought my baby.
Have you answer?
You fit answer.
Yes.
Okay. According to my own information, what I get stroke now when one side for person in brain he start the function fine or he shut down totally, make on the other side for his skin to paralyze.
A good answer that. Very good answer. Any man for crowd know how to recognize when person gets stroke. Where you see person where get stroke, you know him. Any man know him.
On a good afternoon.
Good
Good
afternoon.
afternoon.
Uh, I believe say if I want no person will get stroke, you will see the way where it worker. Maybe it is the side, it is draka and a draka. That's
Mm-hmm.
who you recognize person will get stroke.
All right, thank you. Like all when I talk, stroke na time where something they happen for brain, where the cause and blood no dey flow for different for all part for brain. And because brain they control all thing, when blood no dey go for some part for brain, that part for brain the thing them way that part for brain they control, they start not the work. They start for not the work. So sometimes them the thing the way you go see now say like well brother Joe talk, person the worker he balance day off, he dey drag food. Sometimes then some person he he vision he eye the way they see thing then the jaw loss, you know the see again, or you know the see one eye jaw woke up, you know the see fine, Or sometimes you see us face the jaw twist for one side. There I say you the talk, one side no the move, or even eye the jaw twist for one side. So you just see one side for face the move, the other side no the move. You just wiki for one side. And then person go the talk, person wey the talk fine, like me at the talk, you want see smarter side the talk, blah, blah, blah. or or even not be even like say the year the person the talk, you discover person where fine, it the talk, it is different for you, and then you dey see that other thing and they go on. Now something like that you dey recognize them, and then sometimes then na hand the week or na food the week. But now since that now when you see person like that, if you see some person he go for bed, like if your grandma me go for bed for night, he won't wake up for morning. You dey talk for you, he talk some kind, or he woke up, if he drag his skin out of bed and you notice say one side, that means say he don't get stroke. And when person gets stroke, we for us plenty thing no for we for day for do no day. But the timing for you for take them go hospital be very important. If you wait one day, you wait 2 days, the damage the increase. Different part there, they start the damage more. If you go for hospital quick, as soon as you recognize that thing that it happen, you take them go. Then doctor then fit do thing them for prevent them from getting worse. And then they start get them for rehabilitation, for get back some of that function back, or at least to make sure say thing they no get worse. So for stroke, the thing they for recognize them now: slurring, speech change, face wey twist, weakness for one arm or one foot for one side for skin wey pass the other one. If person be get stroke before and then some new weakness don't come, e mean say some different stroke don't surely dey happen. So it be very important too for recognize say even if person be don't get stroke, so new stroke fit happen on top that old one where they get them, and you fit still do something for help to make sure say make it no get worse by taking them for hospital immediately. And then we don't talk about their vision, their eye when they lost for see, they lost their ability for see, they lost their vision. We talk about even change for balance. It means say some person don't get stroke. Another sign for some different kind of stroke. Now, so you just should on you hear some headache where you never ever get that for your life. So headache way that the worst way, if person ask you, you'll talk say now the worst headache this way I don't ever get that. That kind of headache fit be a sign say stroke the calm, or say it don't start. Now thing that for respond immediately by going for emergency by going for hospital, make they see thing where they go on. Sometimes then the headache they can't wait. Like your eye just dark. Some person will say the eye just dark, the vision loss, or it just the vomit, or you feel like say your skin you touch and you just feel some way. You feel like say they don't chook you with pins and needles them, or say they don't, like say your skin the numb, you dey touch your skin, they feel the same, or you dey feel weak, like that weakness we'll talk about with stroke. Or your person where just will call the confused, where you never ever confused before, or you will call the shake, the get convulsions after a complaint of for headache. It just say, oh, the headache, I never ever get the kind of headache, and then small time it collapse, then just the convulse. Now another symptom that say they get stroke, and now another reason that for take them go hospital. So if person get that kind of symptom, then surely symptom for another kind of stroke for take that person go hospital. So I want make person, I want get question. I want make some people then ask me question about the two thing that I don't talk about right now. Any man get question?
Okay, my question be say, wait to be the cause for this stroke wey we talk, because it don't
Okay.
really be rampant for we now.
Okay. You don't ask very good question. And some person there we go can't answer that question very well. Um, I don't know whether because na whole this na plenty thing then way some person go can't tell we Dr. Sama go can't tell we a lot about I don't want to really go too much into it. But plenty reason and they cause it in them. And just briefly, so make so that if you get some brief answer right now. Sometimes then blood pressure where you don't know about or where you never control and you know about and you know them you know about they take medication over time. Sometimes then for people where they don't get blood pressure, they don't get diabetes for some time, it cause on change them for your skin where if it cause stroke and cause heart problem them. And then sometimes then for some people nah you feel you fall for some
Wait,
some
wait,
big
I don't
height,
pick am.
you fall from like tree or you fall from roof, and initially you be there fine and you no go hospital, you no go look but we during that fall you be don't cause some fractures, some break for your head where you start to cause blood for the bleed inside your brain where if you cause the symptom then. But now just a brief answer that what I think for that thing then. Many Dr. Samago can talk a lot about how the way to be the cause them for these things and be and then how to prevent them. Um, I don't know whether I don't answer your question or whether you be satisfied with the answer, but if you get any more question, just throw it for me. Talk, make a see place where you did.
I want talk small for my brother a question we don't answer.
Mm-hmm.
Say some that the kind symptoms the way it dey happen, person dey
Mm-hmm.
get that stroke
Mm-hmm.
because you dey over accumulate anger. Something dey hurt you, you know, dey let go. You
Mm-hmm.
accumulate them. When you just see that person where you get anger towards you, your heart the beat. When your heart beat like that, your blood the hot. So it attack you, come off of your nerves there. For there, that headache now start do you, then you feel get high, you feel get that stroke. And my own small experience that. So I dey advise my brother, they say, and my sister, they say, make you know the keep anger, make you know the keep pain inside you. And I want to talk say, when you get that kind of pain, if some person know they around you for counsel you, me you pray, let all that pain there for God in hand. You'll see the way you always day you fine. Because when you keep accumulated anger, grudge inside you, it will always cause your heart to for the beat very fast. When you not get mind for all that thing where it pain you, it will give you headache. So now wait till that one I want contribute for tell my brother.
Yeah. Yes, mommy. So sometimes then that's when stress from different thing them when whether na because that when that anger one come, the anger no the just come just because of one thing we don't happen na build up of stress. So sometimes then stress over time fit lead to auditing them. But no be just on one time anger. Something they must don't day from the background. Something like young man wey dey 20 years old where they go farm. No matter how you vex, go if you know get something we some sick for skin, some blood pressure issue then go just fall get so it dey ever start with different sick then the add up the stress then they add up before that kind anger way if it reach make blood hot it cause that kind problem. All right, any more question then? All right, if different question no day, then we will go in for the next thing what we want to talk about. I know say I be mention epilepsy and seizure when I talk about that headache, that strong headache, where if you cause the first person make you fall. So sometimes then people then get so what they call a seizure disorder. People then get epilepsy. People then get convulsion. And we usually you for if the person dey stay for community, una dey ever know that people then. No, they not get am because they get some wish for family, or they dey transform, or something the way they do make am make they get am. Sometimes the thing dey just calm. No be something wey person do. No be anything wey man do wey e dey make am e dey get the convulsion dem. But if person get convulsion, e fine say make we know how to handle that person. Like my mommy or sister be don talk earlier, when person fall convulsion, we find make you make we, if na person wey we know say e get convulsion then say they ever get am, e find make you first of all look the give space, give air, look the place where don't fall for, whether the place be safe. Stone then they way if he knock his head on top, if he dey move am. If you get blanket, if you get like pillow or something where if you put it under your head, you put the next step. So the first step when you see person wey get convulsion, first step now for make sure say place them be safe, say the area be environment be safe. The next step, I say make all man calm down. Make people they know the hot. Say, oh, the charge people they don't move phone. Any man, all man calm down. And then turn the person for his side. And when you don't turn it for his side, the next thing what you get for do, no put nothing for mop, no spoon for mop, no nothing. You no get for put anything for mop, you no get for open teeth. No man will go near the person in mop. Just make sure say you tilt the head up. Turn you for side, make sure say your head be up. And then you start the timer. You start to measure the time. If he make and so still the do it don't reach 5 minutes, carry that person go hospital. Like that what they do for seizures for us. So if person get convulsion, you dey make sure say the environment be safe, you dey turn it for side, you dey support the head, you dey take it, you dey measure the time where the person get the seizures, and then you take it go hospital. If the person they carry medicine, sometimes there's some people they carry, I don't know, Dr. Berlin, correct me if I'm wrong. If they carry injection where they help them, or they carry medication where they put them for more.
No, for America.
Okay. We'll just leave and so. We'll just leave and so. Just make sure say they be safe, turn them for their side, carry them go hospital. Now so you dey react when person get convulsions. And then how about when you dey house with person, your mommy, your pa, or any man, they just woke up, they study confused.
I
Or
get
they know,
question. I get question, doctor,
yeah.
for that conversion palaver.
Mm-hmm.
Before I even ask my question, I hope say all man knows say conversion are the same thing we dey call and say fainting sick.
Mental sickness, yes.
Mhm. So my first question about conversion, I say if person get fainting sick, that way it don't fall fainting sick, you touch it, you go catch am.
No, absolutely not. It no be transferable. You no fit catch am. The person get is sick. Just the same way you fit get fever, the same way your pikin fit get cough, fainting sick, you no fit catch am by touching the person. Absolutely not. You no fit catch am. You need the transfer so.
Okay.
Yeah.
And then the other question where I get Tantuna say, if person get fainting sick, that way it is shake his hand and he foot them, it is shake. If fine for hold that hand them and he foot them press and
Oh,
for that.
no, no hold you down. You like I said, I be talk. You just turn it for side. No hold any person down. No try to hold you down. Just leave
Thank
and make it shake. No hold you down.
you. Okay.
Any other question? All right. If a different question not there, then we'll go move on for the next thing we want to talk about. I will talk about confusion. I talk say when person need mommy, you there for house with person, your mommy, your buy your woman, any man, You woke up, they started talk, you don't understand thing where they talk. Just all of a sudden, like you and person sleep for night, the next morning they just day off. You know they understand, see where they happen. They talk for them, they respond. Sometimes person just no one woke up for bed, they just sleep. You try to figure I say woke up no, they just sleep then. They just woke up, just say then sleep. And then they drag skin, they just be weak. They don't dey for their normal self. You look person, say the person no be the way we be. Sometimes then the person will get fever. Sometimes then they be don't complain say their belly be the one before go bed for night. When this kind thing happen, it means that that person if he get some sickness, if he get infection, if he don't get stroke, na some other presentation, other way some person go present with stroke where you know you just woke up for bed. For that kind of situation, as simple as it be, just carry them. No leave them for her, say they go woke up, because sometimes then na so person go just stay for house. Then before you want know and you say if you woke up, no one woke up for bed, stay for bed for 3 days and then just die. No, you will not get to leave that kind of thing may happen. When you see that kind of thing, you just take them, make they go check them. Because if even a simple thing like they get a infection for peace, bladder infection where they be fit treat them, but you leave and now the infection dey inside their blood and then small time they die. When a small medicine, one medicine be fit treat them. Wey dey for just give them injection, give them water, then they for dey fine. So now something that for take people then go hospital. And then the other thing na people wey dey get trouble for breathe. You dey with people then you should down for house, and then all of a sudden some person start to get difficulty, the breathe. You dey see person dey breathe like there say they catch their breath. Sometimes you dey really see how their chest the waka as they dey breathe. You see how they dey really get they use effort for breathe. Wait till they go on for them. You no know. Nah, thing that way you get for be checked out. Na thing that way you will carry them. The person where you know say they get, I don't know whether asthma na thing wey people they know about. If they get that pump, that asthma pump, you will give them, see how they respond for if na person wey we don't get food them where they fat water dey for food, belle wey fat, hand them wey feel where you there say the food be done the water be done the increase for his skin. That kind of person, a person where you go take him go hospital, because sometimes you think na he heart because I made he get trouble for breathe. So um if the person be the chop and then all of a sudden something like that happen for them, we'll talk about two things then. You sometimes then you'll see person eat the chop and then all of a sudden it started then I say the brain no fit talk. That kind of person fit don't choke for you chop. If it happen all of a sudden where the chop, sometimes if you don't choke something, the first thing I say you want open him up, see whether something they inside him up, you just drag and move her. Or Dr. Beryl, I don't know if you want to demonstrate Hyman maneuver with um
Mine again.
your mannequin. Sometimes
That.
you go hold them so I see the hold and you hold the person, stand for the person in back, and then you push him. You push the belly so 5 times.
If una see when I push and so una see how he head the go, so you could show say the push it. The push and so for navel. You should say my hand in for navel side. So when I put and so I push and now see how he head the shake. It means say I the push air me force waiting waiting for a throat for outside.
And when you do and so sometimes you feel help move the thing, it come out. If the thing come out, they tell you the chop way choke on top. If it come out, the person you breathing will start to improve after. If you not come out, the other thing if it don't happen, if the person be the chop, I say sometimes chop something way You know, agree with you, be allergic to. Sometimes you don't get allergic reaction. You throat don't start the close for you. Now one reason that for move the person, take them go hospital. And then we'll go. But when person get problem to breathe, the first thing you want to do if they lie down, now for sit them up. Make sure make they shoot down go up. If the person they awake, you will realize and say, you said self go wake up, shoot down, sort of like pushes, hold yourself up so you breathe. If the person know, if you see that kind person, that person that will get for HLB, take it to hospital. If you get medicine on you, that breathing treatment you give you, if you don't get that person for rush you go hospital. And then another thing we'll talk about now drowning in as we talk about breathing problems and drowning. If you go and picking them, um, first of all, you want to make sure say if picking the go water, may they go with person. You said say if you go cross water, make sure you go with person. Make person no go enter water after rain when water don't woke up. Therefore, make sure say that kind of thing not happen. Water safety be very important. If you don't know how to swim, no go enter inside water because you feel drown. But if you deal with person and you see and say water don't enter him up, water enter him nose, you don't know how to breathe. See what you dey do now, say you dey pull it out of that water, put it for down like Dr. Berry get that mannequin. And then we'll talk about that compression again. So you go up, pull your head for up, give breathe, you breathe inside your mouth, give two breaths, and then you start to push your chest. And Dr. Berry, you want to stand up, all right?
I don't know. You just say that.
So you dey stand up, put your hand for middle, make sure say you dey on top the person, make your hand dey straight on top for 90 degrees, and then you give compression, then you give. So that's thing, fast, so that you dey give like 100 of that compression them in 1 minute. But you dey do it them in 30. So you do 30 of that one then. When you don't do 30, you bring the head for up, give two breaths. Make sure when you dey give the breath, make the belly the woke up as you dey see and so. You give the breath, make the belly the woke up, and then you go back on top again, continue. You give the compression then. Count 30 again. When you don't reach 30, you go back for breathing. Till the chin up, cover nose, open mouth, blow. And when you blow, make sure say the belly woke up. And you do and so until you get help. When help don't come, una gather that person go hospital. Thank you so much for demonstrating, Dr. Beryl. And then we'll go talk now about pregnancy. I know be me a doctor for woman and picking them. So I know one talk me plenty about that. But I will talk about the thing that way that they ever come for me for inside emergency and casualty. The thing that way you get for recognize them when you get belly or person corner you get belly, you complain about something. So if person way they will belly, they bleed, heavily. Nothing that for go check them out. You know, if it mean plenty thing them, including miscarriage. So nothing that way the person get for go hospital check them. If the person get headache, way the go or it worse, it get bad over time. Nothing that for take the person go hospital. If they woke up all of a sudden, swell for their face, their hand them, their foot then just woke up, big just swell. Now another reason that forget them, may they go hospital. If you check their blood pressure high, the reason that for pregnant person for go hospital. If they get chest pain or if they get pain for inside chest or pain for belly, way really bad, they complain to my belly, they really hot, or they don't already pass that first part for pregnancy, they know the sick there, they know be done that sick for belle, don't finish that vomit, sick. They don't finish that first part, don't finish, and then you don't need go now for that second, third part. And then all of a sudden, vomit start again. And then they continue. Now something surely they happen, go make they check them. And then let's see. Problem for breathe, you get to go. If you be don dey feel pikin dey waka, you dey fear pikin dey waka for skin, and then all of a sudden e no dey waka again for inside your belle. That one na really thing for go make dey look am. And na simple thing wey dey do, dey just look am for see whether the belle still dey waka, see if thing dem dey still move. And one last thing wey I know say we no dey like for talk about because taboo. People dem say oh na taboo, why you dey get you dey bring the happy pikin for world, na the best thing this. Sometimes dem dey wey some sick day wey people dey get am after during time wey dey dey belle sometimes dem, and even sometimes dem after they don a lot of times after they don born, plenty people dey experience the thing, they no dey talk am because they dey fear say people they go say you just get pikin. Different people dem define pikin, they never get am, you don get pikin. Na something wey dem dey call am say postpartum depression. That means say you don get pikin and you just dey feel, you no dey feel good, you dey feel sad all the time. You dey look the pikin, e dey worry you. You look pikin ipa, look your mommy, look mother-in-law, all man dey can help you, e dey you no dey feel fine. You no dey feel fine about yourself. That one too na thing for go check am out. Especially if you start dey think say you wan kill yourself. When e dey happen, no be nothing wey you do. You never do anything to cause that feeling for come for you. No be your fault. E just come for you. If you get that feeling, or if you get feeling like say you go kill the pikin too, you wan hurt the pikin. No be taboo. E hear like say like taboo no. The thing dey like say na taboo.
You
No
want
be
to am.
taboo. No be thing wey the person do am. Now it sound like abomination. E dey happen all the time. Na because you don born, some of that thing there, some of that change there for your skin, some of that hormone them, thing the way they dey happen inside your skin, they don't change thing them so much so that you will feel that way. If you feel that way, talk for person. Tell your pikinipa, tell your mommy, tell your mother-in-law. If you get your pikin wey you dey with you wey be responsible, tell you make they take you go hospital because you no get to feel that way, and na sick no be taboo. I dey emphasize am again, na sick no be taboo. And if person comot call you, tell you say that kind thing dey happen for you, before e wan tell you, e don take all thing wey get am for the world to even open him up tell you. If before e wan tell you, the last thing wey you wan do na say no, you don get the fine pikin, so pikin dey fine, you know the glad. Na the last thing that way you wan tell you. As e tell you, the first thing wey you wan do na for tell you say e be okay, we go dey for you, we go help you, we go help with pikin, we go carry you go hospital, but wait till you want am, we fit do for you. Na the response that way you get for get am in that situation.
Mhm.
And speaking of that kind situation there, it dey only happen na after belle, it dey only happen na during belle. No, it dey happen every day. Na think that way if you take 10 people then, at least 4 people then get that problem. No man no go talk about am because they dey fear. Because for the way they will be there, the way they raise we, they don't put am for our head say no be thing that way they happen. Na taboo. Before you 1 year, some person don't go hang himself. You think say e be comot na one day say he just woke up that thinker. No, nothing that way be done the he be done the feel bad, he don't feel depressed for a long time. Just that one day it happen say he don't get for point way, he don't feel he dey feel like say he no fit. fit function, and people then go be better off if e no dey. So if you dey away, you dey see that kind signs, then dey start for you. Nothing that for talk for person. People then dey do church. If you dey go church, pastor, if you get some people then dey for family where you fit talk to them. If you, that kind people dem, that kind person no dey for your family, you no fit trust any person, go for doctor. Doctor then dey wey dey deal with that kind thing dem. Therapy then dey, counseling dey wey dey talk about that, dey help with that kind thing dem. Sometimes dem self medication then dey wey dey give am wey e dey help with that kind thing dem. Solution dey for that thing. So if e dey go on, you no get for tell people dem wey you think say dey go waka go dey talk. You find the right person, you find reliable person, you find doctor, you find hospital, you go give your complaint for them, they go help you. Um and one last thing what I think say I want to talk about was skip na and also there for bar that I go talk about the one na mimbo, and they call and say alcohol withdrawal wey dey cause problems. So for person wey e dey drink, wey e and sometimes you no even know say na thing that way dey, but for person wey dey drink, may I say like every day you dey drink like five beer every day, na your habit, na routine. So when you don't go farm, come back, or you don't go walk, come back, you don with your friend then you drink 5 beer then. Every day you dey do and so every day. And then Sunday, sometimes either money no day or you sick or something happen. Some person die for your family where you no feel like say you want drink anymore. You fit sit down for house, then you start to get after some time, after like sometimes then 6 hours for some people, sometimes then 12 hours to 24 hours for some people, they start to get symptoms already show say may they go drink again. But then if they no go drink again, then they get what they call an alcohol withdrawal. And sometimes then that withdrawal they can lead to confusion. They call it delirium. Some kind of confusion where it dey make am sometimes you hear say where the person woke up just go lost. We no know place where go. Where sometimes he confused go for inside water, we no know it. Or he confused go lost, we no know. So if another thing wey fit happen too, now after that confusion that happen to the person who just confused, you wan see he start get fainting fit again. Now because of that mimbo wey e no dey for his skin. If you want stop, if be person where you did drink, you dey really drink fine, and you don't decide say I no want drink midi mimbo anymore. It is so I no want drink. If fine, make you go consult, make they help you, make you come out the mimbo small, so that because when you come out, you just come out one time, so boom, if it cause problem, then we if it lead to that thing and what I don't talk about. Um, I think say I don't reach a point where I want make people then ask question them. I actually the thing I want them, I want me person tell me about some situation where if you don't get where you don't know, tell me how you respond. You don't know whether you respond fine for the situation. Maybe we'll talk about thing way, or we will talk about thing way we for fit do for that situation for help the situation. Am I time? Am I running over?
That's fine. Go ahead. Why?
I don't over talk. Now me, I don't talk. I want me person.
I feel add small talk, especially for that one for depression where you talk so dark.
Yeah.
Yeah, I know this thing for depression. Na thing wey the normal no one gree say depression dey so na real sick.
Uh-huh.
Because if person dey sick malaria, they will go check him blood, they go see malaria. If he dey sick typhoid, they will go check him blood, they go see typhoid. And if person get na high blood, they go tie him hand, they go see how him blood door high. Or if na sugar, they go check him blood, they go see how sugar door high. But depression will not get no blood where you go drum to say, hey, this person get depression. Right?
Mm-hmm.
So people then, because they not fit physically see that sick.
Mm-hmm.
So plenty time they no degree say depression na sick. Because even for we for here, you get like doctor the talk, he dey work for emergency room, he dey see all that kind thing. Me, I get my experience now for work with people the way they are sick, not be sick for skin, not sick for head.
Mm-hmm.
You see, I get my experience that, and inside my experience, like the patient the way they work with them, I realize it be very difficult for actually help an African we get depression or mental illness, because no man no one talk about them. Say,
Mm-hmm.
oh, I think to the names the way they give that sick them, like you thought some person go get pikin, where that pikin get some sick, some mental, that pikin never develop fine. Or to say, hey, mommy the man don't born fool.
Mm-hmm.
So it be very negative. So I think for start for change that narrative. Now we as people them inside our own village, we supposed to start to change the way we would talk about the kind thing them. They will just say, oh, massa, black man need get depression. And then you see the rate at which black people then they hang themselves, that they drink arata poison, that they overdose on their medication. Because say wait, they not they feel free for talk say this one, I think this why they feel them inside me, say I be sad. They go put that fake smile for fit in. So that make people that know say they too they day. And where inside them, they need to sleep for night, they cry, they hide all that negative feeling them inside them. Like how my immaculate be talking. That when you dey hide all that in them inside you, it dey build up, and over time, it not go only be the mental illness, it go start manifest too for physical illness. So you're not going to only try for get treatment for one thing, you will try now for get treatment for plenty thing them one time. Where you really need for come for that point where if you dey feel sad inside,
Mm-hmm.
you dey feel sometimes some question in the way you go ask yourself if you be dey used to sleep, because sometimes people they just hear about depression. If you ask them say depression na wetin, they not really know wetin be depression, right?
Mm-hmm.
If you just she don't like you where she don't for day now for inside that body, she don't ask yourself the question, how many hours for sleep I dey sleep for one day inside 24 hours, how many hours of sleep I dey get am? If you be used to sleep, you say from 9 o'clock for night to 5 o'clock for morning time or 6 o'clock for morning time, and then you realize say sometimes all wey you want na sleep, you no wan wake up you for bed for do anything, even for go farm or for go work, you no wan, in short, all till the job worry you wan just stay you for bed. But some other people, even although they dey stay for bed, they no dey fit sleep. You ask them say why they no fit sleep, they no know why wey they no fit sleep. Some people just want for like they talk about alcohol. Some people then just because say they feel sad inside them, they just want for the drink alcohol, drink alcohol. That not be said they really like for drink, that the way the alcohol they make them say me they forget their trouble, me they forget say they be sad, me they forget, so they all that kind of thing. Them. Some people then just take comfort now for chop, just the chop carelessly. Other people now say they not just their appetite just we call loss. Not be say that they sick any sick, they not just get appetite for chop anything. So you ask yourself that question, then if that thing that dey happen for you, it means say sometimes you be depressed, you really need for fight for talk for somebody where you trust them, or go consult, tell nurse or doctor say I think this way e dey do me, so that me they help you. I get like you talk a scenario one, I actually get experience where I get a young African lady where he get na that postpartum depression, where he born like he hate all him family members. He no wan catch him man with the eye. He no wan catch the pikin. Na the papa for pikin don turn am mommy for pikin. Na the papa for pikin dey carry pikin. All time, that woman in dey do no nothing. You go for a house anytime where you go, he dey wey sleep for on top chair, e dey gree wake up. But they never come for the point where acknowledge and say this, so he really get problem where he need help. If family never understand say he need problem where he need help, then instead to say, oh, that girl over wicked, that girl do this, that girl do this. So it take a long time for continuously for the talk for them say, see, this girl need for go hospital, he know well. This girl need for go hospital, he know well. Thankfully, they don't start realizing this, so he actually get problem. They don't start to take it, to go hospital. But for more than 6 7 months, dem dey only talk say dat girl over wicked. How woman go born so e no dey gree take care for pikin, na im man dey cook, na im man dey take care of pikin, na im man dey go up, na im man dey calm down. So, and as dem dey continue dey talk, so wetin dey happen, e dey push the girl more and more into depression, to the point wey e don be already, e be don already dey consider for end im life. So this thing na thing that we need for talk about. Mental illness be real. It dey amongst us, not only for village, not only for Cameroon, even for we for this country. Plenty African black people dem dey wey dem dey suffer depression. You see, sometimes a family go dey for back say, since wey Joe go America or he go Europe, he never come back. He no dey call no man. They no know thing wey Joe dey go through. Joe get serious mental health problem. He be depressed because he no be expect the pressures the way they dey for days. So he be depressed. So we really need for come for that point where we fit talk about these mental health problems and how to manage them. So no suffer in silence. Find somebody to talk to. Find somebody where you trust. If you not get anybody where you trust, go talk and go consult for hospital. And for we like family members, like friends, like neighbors, if somebody trust you enough or tell you say nothing this way it is suffer am, not be for you for to say, hey, you don't hear, hey, you don't hear. You can't turn a town crier. John know say as you turn town crier, so if that person decide for any life, now you buy the rope give or now you buy the gun give, although you not do am physically, but your action do am. So we really need for be one another skipper when it concern these mental health issues.
Thank you, Dr. Berlin. And for just adding that really important piece, because I think say if we talk all these things then, but if we not talk about that one, then we'll never really talk. Um any man else get anything for Adam, any question, anything else regarding this thing that we will get for respond to go to hospital for? I know I hear any man ask me say, how about Pekin? I just realize I not talk about Pekin them. No man never ask me.
So since we talk about picking, I guess if he ask the question, then maybe Sister Berlin fee if he do demonstration so that many people then to see him. You will teach we earlier about CPR for adults and
Mhm,
also the hermit maneuver as well for adults. So in
mhm.
the case of Mo say picking will be less than 12 years old or infant, where they be the chop or they begin with the play with something enter a mob, how we go fee do CPR or how we go fee help the pikin come back to consciousness.
Okay. Thank you for that question. Ask that question. So thank you. I will go a little bit into so other thing then too we get for look out for when we get small picking. Then we'll talk about how for do CPR and take care of choking inside small picking there. For small and I want add I only get a small this thing inside picking there. Now so then why I know even can straight for my head because I dey work with adults or I need to work with picking over even though my training include picking them. But when you get small picking, you want to make sure that say picking the chop fine, picking the grow, picking the breed fine. When for any picking way in over we never chook injection for vaccination or if picking way still dey under 3 months, if you get fever, I really think for carry you go hospital because fever for that age for people wey never get injection dey ever been as because of e fit been as because of serious infection, and wan make sure say the doctor dem give the pikin the right antibiotics for that one. And then when if pikin get fever and you dey for house with the pikin, doctor dey don tell you how to control the fever. E don reach 3 days, the fever never yet improve. Na another reason that if the fever never they still get the fever, na reason that for take them go. If they no dey chop, if they no dey drink, small pikin, most of his skin na water. The breast milk wey you dey give them, the bottle wey you dey fill. So if they no dey chop, they no go do fine. Take them in, make they go give them small drip, make they dey fine. Um, if you get pikin for house and in the small baby wey you dey carry am for house, dey still suck. If e no dey suck fine, e fit be because e get sick or e no fit breathe, na why that e no fit suck. If that one dey happen, e fine make you take them, make dem go look, see wetin dey happen. If pikin, you see say your pikin dey breathe with problem, and how you know say e dey breathe with problem? Sometimes they dey breathe, their nose dem dey hook up. Because when you dey as you always you dey look our face dem for camera, we dey breathe now, so we dey breathe oh, but you no dey see say we dey breathe, right? Because we no get no problem for breathing. But when person start dey breathe, the chest dey hook up, you dey see. I dey try for make am sef, make nose for pikin dem, if you see as they dey breathe, nose dey flare up so, or you dey see like for up here, you dey say e dey suck. Every time you breathe, you dey there say e dey suck for there, or even for chest, in between chest, e dey like say they dey suck inside, you dey see how the ribs dem dey suck in between them. That means say that person get serious problem with breathing. And sometimes you no fit help am for house, so you better take the pikin make go down for place where they go fit help them for breathe, for help that breathing. And then if you see am, their mouth dey turn blue. No be blue color, like some dark blue, so on their skin, that pink for bikini skin, no dey that the color for the skin, no dey don dey look like say they like dye, like ash. It don dey look bad. Now that one you know dey even say no, make a go call mommy this, or make a no, that one you dey rush in and rush, dey run around, you dey find motor take you go hospital. Um Now, if you dey with small pikin, you don fit put it for bed, you wan hear you run go for there. You see am say sometimes foam dey comot for more or milk dey comot for nose, milk dey comot for mouth. Wetin you go do? So Dr. Berlin go do that choking
Mm-hmm.
thing.
For
So
that baby.
for that baby. So
Mm-hmm.
one thing wey you wan do now you go take the pikin as hold ye, yes, hold ye so, tilt ye down, and then you give taps for your back, and, and then you turn it around. You give like 5, turn it around, do the same thing, tilt it down, and then taps. For small pikin way over small, you no want do it, so you go broke your ribs, and you use your 2 finger, then there you go, and then you open the bulb. Look, something there. If you see something, you take your small finger, put that inside the swipe am, move am. And then if you succeed, move am fine. If na milk wey na water, you know fit swipe am, move am. When you do that this thing, so it go cough, it go come out, move am. At least you don't help for that choking. Do am, help, nothing no happen. You see and say that it is still worrying. Call help, take the pikin, una go. And while you dey for road, you dey still do the same thing. You know go just hold e for hand, dey inside motor. No, you dey do the same thing as you dey inside motor, you dey go hospital. You do am continuously, and then At this point now, if you never move the thing now, you go give the breath.
And for small picking them, because they are the distance between their mouth and their nose small.
You
You
just
go
put your
take
mouth
your
over.
hold your mouth, you cover the picking in nose and in mouth. You give it those two breaths. If the person picking don't stop for breathe on your own, you go cover and hand.
Mm.
And also, when we earlier, so you go check pulse for big man, you go check his neck or he hand. So
Mhm.
for picking, so in that case, Musa you go check the pulse, or and then how many when you did knock it to, how many times you go knock it as well before you do that swipe for the mouth.
So if they begin the choke, you go do that taps then 5. But if they begin know the breathe, or if you check the pulse for years, so
Mm-hmm.
yeah. If you check you know the worker for day, you go give 15. Instead of do that 30 where you be punch am, you go do 15 and then that 2 breaths. 15 and then 2.
Thank you.
Any questions for Hall? Or any person get anything for add?
Okay, ma ask question.
Would you see a ceiling?
Uh, okay. Um, uh, my question I say if picking choke on top thing like soup
Mm-hmm.
or water,
Mm-hmm.
we see use those very techniques there. They show 'em.
Yes, you still use the same techniques then because that soup and water, they as you push, when you push because sometimes when we talk about how it work, it help more. When you push that belly, so it move air, then push the air for it move air for belly. That forceful as you push and with force, that forceful air for belly, then can push whatever the block for inside through the push and out, and whether na soup or na cocoa or na wetin go comot.
Okay. Where am na for me?
Good afternoon.
Good
Good
afternoon.
afternoon.
Yes. The one when a side pain when you worry picking, I had to do that one when I fit tell we. Because for here would over get side pain, the cold. Cold.
I think they talking about some that strange illness where the whole picking away for night, their food they cool.
Yes.
Then their head they warm.
When they want
Yes,
sick.
yeah, yes,
Yes.
you don't remind me, self. That sick, I don't hear about all sick them, but I don't know name for that one.
Yes. Call and say side pain.
That's the class
Now,
a side pay.
yeah, for now waiting.
That that one just for that small way you talk, so
Maybe explain more.
that small way you talk, so they really I know they really I need more information for really noting way I feel explain. And if na some sick way day for una for day, and I probably don't know about them because right off the back, the strike, the jog anything from my memory. But if na side pain where they get down with cough and
Yes, it
fever,
can't wake off. It can't wake off.
it
Cough
come with
and
cough and fever. So
yes.
and it come for picking.
Yes.
Sometimes they get trouble. Wait, there I say that breathing problem what I describe. Sometimes they get and two with
Yes.
them.
Yes. Yes.
Yes.
Yes.
So sometimes if it been a pneumonia, where they get for take then go hospital check her out, where the doctor will take that stethoscope, the air high the breathe, um usually if they see say the breeding the make some it shows say some problem there for one side for lungs them, then they go treat am with antibiotic. They give you medicine where you if you take am for house, it go help with they'll give you medicine for fever, then give you some antibiotic for treat if na infection for lung, they'll give you make you treat am. And sometimes then too, no be even bacteria they cause the pneumonia. Sometimes then a different thing than they cause so medicine and they then or thing they will do, they tell you how to cough, how to take control of the fever, and then depending on the kind too, some kind medicine and the way they some kind cough medicine and we get to different kind ingredients then for the way they give some syrup then way they give if he help from for bring them out, clear that lungs then.
All
Now,
right.
if not the side pain then na for up for chest, then nothing that we will think about. But if the side, if you talk now, na pain way there for down or na pain way there for up for chest, na pain way there for down for belly.
That corner belly, corner belly. All right.
So I think
When you touch it, ever beat no, it beat so tat 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 fast.
for right side, for corner
Yes,
belly,
yes.
that's right upper quadrant.
That's only left here. Sorry, na left side. Na left. Na left. Na left. Na see.
Abu, good afternoon. Oh.
Good afternoon.
Yes, I want chip in something concerning that side pain way mommy they talk so.
Na left.
Now
Okay.
mostly on the left side and like Dr. Ben is on accurately talk. Now usually an infection. That thing is more of a sign. Yes. Now the spleen, now because spleen mostly on the left side.
Malaria.
Non general plenty different infections if it cause some pneumonia as we talk cause some malaria if it cause some the spleen they just react to that infection from whatever bacteria or viral cause. So now just that side pain they ever talk so now just picking his spleen don't distend the hot the cause that pain. Then when they touch and for they get the impression say enlargement then maybe the fever, the cold feet. So what they call side pain is just splenomegaly.
Oh,
Yes,
gotcha.
Yeah.
yes. Just
Thank
think that
you.
way.
Thank you.
Thank you for yeah. I be the one make the flesh.
Yes,
I be the one make the
but
flesh and out because some I be really want to talk about that side pain because I know that side pain is some very common thing
Uh-huh.
yes. Now just
for
a sign of just a sign of infection. But when mommy then take her now, they go start cut contremexin. But when the right thing for do now
Exactly.
say yes, the right thing for do now say me they take and go hospital, me they investigate the source of that infection and they treat them
Treat them.
appropriately. Yes, but mommy they ever go corner contremexin day. So side pain are just spleen enlargement.
Phenomenally. Okay.
yes.
Yes. Thank you.
Thank you, doctor. Thank you, doctor. Now, Doctor Achiri, right?
Yes, mom, yes.
Dr.
Yes.
Achiri, nothing that way we know this year a lot for years, so so
yes.
sorry, so I know we get them right away.
No,
Exactly. Now just the same to actually tell them for yes, say you know they common for now for day, but it's quite common
Yes,
with us. And the
yes.
bat will take them they go cut them. When they cut
yeah,
them, so they want come picking for hospital it already the advanced state. So not
yeah.
really a problem. We'll get them back home for you.
Okay.
Yeah. And so if I as you don't explain and so because the one thing I want talk and me I be village girl, I grow for plenty villages from
Yes, for sure.
from Bay village to Manfe, Umojok villages. So now something where that would see am a lot growing up. They say, hey, that pikin don't die side pain. That pikin don't do this side pain. It is side pain. But of a truth, they say that pikin the overget side pain. That pikin the overget side pain. Now because like Dr. Achille rightfully taught, when the pikin get that side pain, they ever come they say, oh, he had the hot. That pikin the get a fever. And of course, if that the cold.
Mm-hmm.
So the doctor say they get side pain. They'll go concoct that contromexin or they'll boy that contromexin they give, but they never address the root cause. They dey try to manage the symptoms, but they never address where to the cause whether picking to get uh, um that pikin dey get that side pain. So wetin dey happen na say sometimes they go make am so they give that pikin Tylenol or ibuprofen and then e go cool down small. They go say, hey, that medicine don help. E go wan make 2 months, 3 months side pain don come again. Na the same infection because say they no dey treat am when they try for put na small plaster on top. When you
Mhm.
move that plaster, the sting come again. They'll say,
Mhm.
hey, that pikin sinks it on the get it wey dey small, they get side pain. So e
Mhm.
dey very important like Dr. Achiri talk say if you get pikin wey dey get side pain, take him go hospital make dem check wetin dey cause that side pain so that they go treat the root cause of the thing wey dey make am that pikin na spleen. We know cow when you go for go buy cow meat sometimes you talk say you wan go buy spleen. Human being to get that spleen and that spleen dey play very important role for body. So when that spleen be overwhelmed with infection or thing, e go dey swell too. So e really fine say make dem find wetin dey cause that side pain, treat am so that that pikin no go dey get side pain again. Na so mami be ask that question. No, answer the question.
Yeah. Yes. He dey for different place, but I sure say the question not be answered.
Okay, Papa.
I hope say don't he get the answer.
Yes, even all my three picking don't get that very thing. Although we
Okay.
don't pass, but a very pertinent question. That way, many parents
Yeah.
they give you the answer.
Yeah.
Mhm.
Almost 80% of picking them before they reach the age of 7, they suffer those symptoms.
Yeah.
Yeah. We got a lot of common infectious diseases. So if one pikin get am, I dey call small pikin dem say that they be germ farm. If one pikin get am, e dash am for the other one. They no dey share different thing, but they share their germs very liberally.
Mm-hmm. So their hand they ever dey for mop.
Mhm. Any other question?
I don't think this person get question there. Some the people there every day they don't come out, and new one they don't enter now. So we just proceed.
Okay.
Okay, so actually it just wrap up thing what we get for talk. I hope say at least the people where they don't they get one or two thing them. I hope so they will be able for implement that thing them for as they come out there around thing and they happen. Hopefully that thing they not happen for them for even do anything. But if they do happen, I hope say they this information will provide very brief information will provide them fee save at least one life.
Thank you, Dr. B.
You're welcome.
Thank you so much.
Yeah. So I get one unfortunately say the people that they from the beginning, some of them don't come out. Because I want to say if we get like 3 or 4 people then tell we one thing where they don't learn and for year, where they go practice and moving forward. Even our volunteers, one thing where they don't pick up from here today, it go serve as a recap.
But me, I learned
Okay.
say
Yes. Me and he talk say wait you are all learn about that side pain because it don't remain an enigma for me for a long time. All the other pieces of information I don't get them from different sources, but now today we at least I don't get any forum where they don't talk about that infection for picking them.
Okay.
Well, thank Mami for actually asking that question then.
Mm-hmm.
Yeah.
Except from Dr. Achiri, anybody, any other person fit talk in the room fit talk with you way one thing we pick her up.
Good afternoon. Oh.
Good afternoon, ma.
Good afternoon.
Okay. I've learned that when somebody is conversing, like you don't put something in the person's mouth like a spoon, and you don't hold the person down. You clear the space around the person. Thank you.
Thank
Excellent.
you. Yes. Yes.
Any other person?
Any other person, anything you don't learn I don't know. It is say no other reaction. No, they come from now.
Okay, that's fine. All right. So I think we will send out the recording so people then feel share them, and we really take time, and we thank Dr. Bernice Foryoung for a time, because if you get to if you get na 30 minutes, but you do a fantastic job for just answer questions and layout, so we don't go well over an hour. So that we will plan for another session where we'll talk more about prevention. This one we don't focus a lot on how uh, for manage emergencies, and it talk about na wait heart attack now.
Mm-hmm.
Talk about heart attack. They talk about strokes. They talk about breathing emergencies. They talk about drowning. They talk
Mm-hmm.
about fainting sick, and they talk about
Pregnancy emergencies.
Postpartum.
pregnancy. Yeah, pregnancy emergencies. You talk about mental health and concerns and mental health emergencies as well. And they talk about how to handle emergency for small pikin them, especially choking emergencies and breathing emergencies for small pikin them. And we thank you plenty for take time for really discuss this thing then with us. And I want just add must say highlight one thing about that stroke thing. Dr. Bernice really explain am for we, and people them for inside room they be talk how they dey recognize stroke. And some one thing wey if you forget anything wey be talk, because sometimes people they the only one know say the person don't get stroke. Na that way the stroke, the big stroke don't happen. So tey the person e dey waka drag one food, or in the fit talk, or something don't happen. But I think one thing wey Dr. Bernice bin dey try for pass am across for we na how for recognize am early. Say that person, some person they can't get stroke, or if they get either in the process of getting a stroke, so that you go immediately take that person go hospital, make them prevent as much as possible. Make the person not reach that stage where it go get all that late complications then for stroke. So now wey we dey talk about, if you dey talk with some person, the person dey talk fine, and then once you say the person dey face the start, the not the balance, or speed dey start comot for one side more, or e talk just the draw. So I think one something wey dem dey call am say fast, right, Dr. Bernice?
Be fast.
Be fast. So you fit tell we a little bit about be fast,
Yes, I
but
fit.
e go
Yeah.
na just for highlight, and so that people
Yeah.
that dey dey for there right now, they will get something be fast for keep am for their mind, for
Okay.
recognize early signs of stroke.
Yeah. So be fast na abbreviation where they use for where people when you study where they help you recognize that symptom then quickly without even thinking about them of stroke. So B stand for loss of balance. So B for balance. If person get any loss in their balance, um, that one could be a symptom for stroke. E stand for eye, vision changes. So when they talk vision changes, they mean they're like sudden loss of vision or decreased vision. So if anybody get that or double vision, so that one on its own could be a symptom for stroke. And then F is stand for facial droop. So we talk about that symmetry for face as one side for face feel weak compared to the other. One side no dey move. You dey see person wey dey drool, see as you see them, their face no balance, that one could be a symptom. And then A is stand for arm
Um,
weakness, and not before only arm. If you also be leg, but they use now the A way easy arm. So if you put arm for up, it just fall, or it not be as strong as the other one. That one also symptoms. And then S is stand for slurring of speech. Slurring for they just call that
in
big
the
word.
drag
Don't
talk,
mean saying you talk. It
in the drag talk.
it drag talk exactly. So that one another symptom. Then T stand now for time. So it means say timing for the thing be very important. As soon as you recognize say person they get this symptom, then the time from the time